Following breast surgery, is it advisable to carry on wearing a supportive bra at night even after the initial advised period? Right. Question now? Is the answer to that question in the question? Right. Is it advisable to carry on wearing a supportive bra after the initial advised period? So presumably the initial advised period is the advisable time to wear it. So we wouldn't advise. So it's not advised to use it after the initial advised period. But I know what you mean. So I'm just being semantic. Thank you for that. So semantically speaking, then no, because the advised period is the advised period answers in the question. Thank you, Corinne. But I get where you're coming from and I know what you're saying. And the answer is it's absolutely fine to wear it after the initial advised period. So the initial advised period is just advisory and you can carry on after the advisory period. I mean, everyone's different. I normally say 6 weeks, 4 to 6 weeks, really, for a supportive bra. The swelling and the shape and what have you normally don't settle till around 3 months. So, but I just think it's a lot to say you've got to wear a bra for 3 months, a supportive bra for 3 months. Depends on the time of year. This time of year, fine, no problem. Summertime, bit of a nightmare. The bras, big straps and all sorts. So I normally say, look, after 4 to 6 weeks, you can. Did I say months? I meant weeks. Can we roll back the VT? Did I say months a minute ago? Anyway, 4 to 6 weeks is what I meant to say. So I normally say 4 to 6 weeks simply because it's a big deal to wear it for longer. But a lot of people say, can I wear it longer? I'm like, absolutely, you can wear it longer. You can wear it as long as you like. Look, Corinne still wears hers sometimes. It's comfy. So a lot of people like them. A lot of people want to wear them, particularly if you're doing sports, if you're going out shopping, stuff like that. Then you might want to wear a more supportive bra. Absolutely fine. There's no harm in wearing it past the advisory period. Absolutely fine. So in a way, it's just like the 4 to 6 weeks is kind of like the minimum that you really need to be wearing support. But if you want to wear it longer, if you feel comfortable wearing it longer, absolutely fine. Maybe they are asking if it makes a difference wearing it longer. Good one out of 12. Thank you for that. So yes, maybe they are. So the problem with these things, it's always a balance. And I think you might find that it will help the swelling. So there might be a benefit in wearing it longer. Having said that, people often don't like it. They're big straps. They might want to get back into their normal bras. So around 4 to 6 weeks, you can make that judgment. So yes, there may be some benefits in wearing it longer in terms of the swelling, and it might be more comfortable. But there might be some downsides in terms of the fact that you want to wear a less sort of obvious bra, and you might not like the look of the bra. So it's a question of balancing that up in your own mind, because the benefits in terms of the swelling and the discomfort will be less at around the 4 to 6 weeks. You know, the maximum for the first 4 to 6 weeks, they kind of get less after that. And if you haven't got much swelling, you haven't got much pain, you're reasonably comfortable, then you might say, well, actually the balance is towards wearing a more aesthetically pleasing bra. And I'll put up with the fact that it might give me a bit more swelling. And if it does swell, I can always go back to the supportive bra. So yeah, there may be benefits in wearing it past the initial advised period, and basically you all know that. That's a lot of this stuff, to be honest with you. A lot of this stuff, the patient know. You know, it's like you will say, look, you shouldn't drive at this time, you shouldn't do exercise, you shouldn't. You know, you can start running at this stage, and you can start wearing a normal bra at this stage. But a lot of the time, your body will tell you, and if you don't feel up to it at that stage, you will not start running or driving or going back into normal bras. You'll just say, look, it's uncomfortable. And I'm like, yeah, well, listen to your body, because when we say things like 4 to 6 weeks, that's a very sort of like generic. It say that to everybody. You know, some people have bigger operations than others. Some people heal up really well, really quickly. Some people don't. Some people have pain, swelling, and what have you for a long time afterwards. Sometimes it's all settled. So it's very different with different people. So the bottom line is, to be honest with you, the answer is listen to yourself for all of this stuff. We will guide you, but it's listen to your body, you know, and if it's uncomfortable, then don't do it. And if it is comfortable, then carry on. I think that we should just put that on the post-op instruction sheet, you know, for all comers. You know, if it hurts, do less of it. If it's okay, then carry on, do more. Start gently and build up. Post-op instruction sheet for everything.